Hello and Assalamu alaikum. Ultrascan Diagnostics. Here is the CBCT of the patient that you had requested. The area of interest hasn't been mentioned, so we'll go through the entire CBCT. The upper right lateral incisor, the first quadrant, is endo-treated, but there is a periapical radiolucency. If this tooth is to be extracted, we've got a ridge width of approximately 6.5 millimeters and a height of approximately 13 millimeters. We've got a buccal wall defect there, perforation. These are the two abutment teeth. We've got a class 5 cavity on the upper right 5. This is the region of the upper right distal to the upper right 5. So we presume this is the sixth region. This we've got D3 quality bone ridge width of approximately 6 millimeters and a height of approximately 13 millimeters. Moving to the region of the 7, we've got again thin ridge but approximately 5 millimeters of ridge width with 5.9 millimeters of height. We've got sinusitis here. If the doctor wants to do a lateral window or a sinus lift, they should be aware of it. We've got an impacted canine in the upper left quadrant, and then this is covering up all the bones. So this tooth will need to be extracted and grafted prior to implant placement. If you go distal to the 3, the region of the 4, we've got again D3 quality bone with 5 millimeters of ridge width with 10 millimeters of height, and in the region of the 5, we've got again thin ridge, 3.7 millimeters of width with 10 millimeters of height, and the region of the 6, again we've got very thin ridge which will not be able to support an implant. The lower left quadrant, we've got a mesially tilted 7, an extremely thin ridge here. It will need to be augmented prior to any kind of implant placement. Moving to the lower right quadrant, again we've got a certain area where one implant might be possible to place. 4 millimeters, 4.9 millimeters of width, 12 millimeters of height in the lower right 4 region. 5, 6 region, you've got very thin ridge, and hence implant placement is not going to be possible.